Hi, my name is Vaibhav Jain and I'm the founder and CEO of Aayush Bharat. So Ayush is a short form of Ayurveda, Yoga, Unani, Siddha and Homeopathy. These are all traditional wisdom of treatments which are present in India. Close to more than 5,000 years ago, these treatment practices were prevalent in India and have helped us survive, for a very long period. However, still we are seeing that a lot of population is succumbing to lifestyle disorders. It's quite painful to see that even though we are in a country where we have huge strong traditional information is there which can help people survive and which can help people thrive, but still we are lacking. So the challenges that I see is number one, which is awareness and acceptance. Second is we want very quick fixes. We want our orders to be delivered in 8 minutes. However, we have to understand that the diseases that we've acquired have not come within minutes. Hence, the solution will also not happen within minutes. We have to be patient and we have to be more aware of our body. And third is, we have to evaluate very smartly where do we want to deploy, where do we want to go with Ayush, or where do we want to go with the modern treatment. And it's not like these are two antipathies, or if you go with modern you cannot go with Ayurveda, or if you go with Ayurveda you cannot go with modern. One needs to be very diligent. And however, this clash or this confusion is another challenge that the overall Indian Ayush industry is facing. If we see how the modern world has evolved, just take an example of yoga, how it started from India and then it has changed lives across the globe. Ayurveda is basically the umbrella body of yoga and has the similar capability of addressing so many lifestyle disorders that we see on a daily basis. However, what's lacking is the awareness. The reach of the right information to the people at the right time is what is missing. So that's one area where there can be opportunities for people to spread the knowledge, to spread the wisdom. Second, today when we all fall sick or succumb to any chronic condition, we all look for a medicine. Those medicines are actually treating. That's a question of debate. However, we can definitely say that Ayurveda has been treating all these situations. For example, mental illness or issues like depressions or issues like infertility, where there are so many time proven products. What we need is we just need to evaluate this wisdom which has existed for more than 5,000 years, now vetted with the modern science, as that's the language which people today speak, and create sustainable products. So that's another opportunity where people can dive in, do clinical trials and understand and set the right principles, set the right regulations, what's right and what's wrong. And third is creation of these sustainable products where you can build the products which can really impact. Third is, and the last that I see is the implementation of the technology. Today, all kinds of apps and all kinds of diagnosis methodologies have been developed by the scientists and by the engineers. If that is combined with the traditional knowledge of Ayurveda, that's another area where people can work and deliver solution. So in a nutshell, it opens a whole gamut of international business and opportunities where most importantly comprehensive and personalized care can be delivered if it's done properly. So if we look at the situation of our country, we are world's youngest population, where we have a large portion of our young people contributing towards Indian economy. People are falling sick, succumbing to diabetes or succumbing to heart attacks at a very early age. And I believe if this is not tapped properly, then very soon we are going to be finding ourselves in a situation where India, one of the strongest country, can become one of the sickest countries of the world as well. The global healthcare market, if we talk about, stands to around $14 trillion by the year 2030, and the Indian Ayush market, as we talk of today, is $16 billion, which is a CAGR of 15%, and it's going to be around $40 billion by the year 2027 and $60 billion by the year 2030, which means that there is a huge appreciation by the people, and there are a lot of government policies that are supporting this growth. However, it looks like a very exciting figure if we look it from the perspective of a financial analyst. It gives a crazy niche. However, the problem is, if it's not addressed, then the daily 40,000 people who are being diagnosed with some kind of chronic conditions, 50% deaths that are happening because of these chronic conditions, and a huge chunk of our GDP is being spent. So that's where the healthcare market is and the Indian Ayush market is. So while working in the US, I was diagnosed with a critical condition of gouty arthritis. I spoke to a couple of physicians and doctors and realized that this situation is an incurable one. I had to take medicines which derated my health condition and killed down all my efficiency. However, I was lucky that I knew a doctor, an Ayurvedic physician in Kota, in remotest place of the country, who could help me in dealing with the situation, and now I'm perfectly all right. I just follow the dietary and the lifestyle guideline that he has given me, and I've not had any gouty arthritis attacks. Similar were the situations where we came across where people find themselves in a position and Ayurveda has helped them. This was really intriguing, and I was very much excited to see that people who have lost hopes are now finding solution, and we, coming from the background of India, which is a huge heritage of a huge knowledge of Ayurveda, has the ability. However, it was surprising and shocking that discovery of these experts was still, even in the year 2021, was still a challenge. There was no platform where you could evaluate and find out the right Ayurvedic doctors. So I, along with my co-founders Vishal and Abhinav, we sat and we delved upon how we can help and solve this problem. And that was the idea when the genesis of Aayush Bharat happened. Ayush is basically again Ayurveda, Unani, Siddha and homeopathy. We started with Ayurveda, but we realized that people have huge abilities in the other segments of Ayush, like homeopathy. It works really well in some of the cases. So we thought of integrating them all together and bringing up a solution where all of these doctors who are except the modern ones can find a place where they can leverage the technology and deliver the solution. They can share the knowledge and wisdom to a common person, and also do an audio video consultation and deliver the products. And that is the entire background or the basis on why we are doing this. We look towards creating Aayush Bharat as one go-to platform whenever anybody falls sick, and as the preferential platform to learn more about this traditional wisdom of Ayurveda, Unani, Siddha and homeopathy, to consult with the doctor and the order medicines. If we dig deeper, then we look to expand it beyond the geographies, right from 60% of the coverage that we currently have to make it accessible deep down the country. We also plan to set up 300 plus cloud clinics, where these cloud clinics will become like a fulfillment center as well as the telemedicine partner, where people can actually consult with these doctors, and if required they can actually go and physically meet and talk to the doctor. We're also working towards making the services and products more affordable, and working on a few categories and rolling out a few products where we are working towards creating right products at the right price, making it affordable for a larger audience, and thus helping India becoming healthy and achieving the dream of making Bharat Ayush with Aayush Bharat.